Now this is a very interesting X-ray of the chest where we can see so many findings. When we see that this is an X-ray of the chest and this is a PA view, and what we can very nicely see that this is the right lung field and this is left lung field. We can see that right is marked over here. Now what we can see, to see the symmetry of the lungs, we should always first track down the trachea. Now where is the trachea? In this film, the trachea is can be seen very crystally here. This is the trachea. So this is all trachea. This is the midline of the trachea. This is the right main bronchus and this is the left main bronchus. So if you can notice it very well, you can see the trachea is outlined here. It means that the trachea, we can see these are the all central vertebral spines. These are all central spines. So actually trachea should have been lined like this, but instead it is shifted to the on right side significantly, telling that the trachea is being pushed by something which is on the left. So uh, the this dense white or rodeo opaque thing, because the angle is not clear. See, on the right side the angle is pretty clear. The costophrenic angle is pretty clear, but here it is blocked. It means that there is effusion for sure. So there is left sided pleural effusion for sure. Now it can be either collapse. So if there is so much dense white structure on the left side, radio opaque structure, so what it can be? It can be very few things. It can be gross pleural effusion. It can be basically a mass or lesion, or it can be collapse of the lung. Why collapse occurs? Collapse occurs because of non-drainage of the bronchi. Many of the time, suppose the endotracheal tube or the patient is intubated, the tube should come above this. This is the medial point where there is division of right trachea and right bronchus and left bronchus. Those are tube should be always above this. If by any reason, if by any mistake, if the tube is put below than that, then this left bronchus will be completely blocked, so that the mucus, the secretions will not be suctioned out through the suction machine, so that all the mucus will be secreted here only, and it will block the complete left main bronchus and the lung can go complete white, which is called lung collapse. So we must understand, in lung collapse, the lung volume will shrink. The lung volume will shrink and it will not expand. So if the lung volume shrinks, then the trachea should be pulled toward that particular side, or the trachea should remain more of a at the same place, but it will not push the trachea. So if it is pushing, it has to be something very rigid, which is pleural effusion and which is a mass. So mass usually can be at one particular place. So it cannot usually completely occupy the whole space from left to right, and it should not actually block the costophrenic angle. So most probably someone can have a mass with gross pleural effusion, or the patient can simply have gross pleural effusion because of infective pathology. So any infection like pleural TB or TB of lung parenchyma, which will have consolidation, and it can definitely create large pleural effusion, as well as if someone has any CA lung or CA breast or any cancer with metastasis to the pleura, this pleural metastasis also keep on creating the pleural fluid again and again and again. So the patient may have malignant pleural effusion. It is not possible to differentiate on the basis of this radio opacity. If it is infective pleural effusion, usually the fluid can be straw colored. If it is malignant, there is pretty good chance that that will be hemorrhagic pleural effusion on tapping. So it will be almost always a reddish color, and it will be thick if it is malignant pleural effusion. So this is a very clear cut case of gross pleural effusion, which is obscuring the left costophrenic angle. You can see the intercostal space. This intercostal space, you can see it looks slightly widened because of gross accumulation of pleural fluid, and there is marked shifting of this hard border to the right side, and there is shifting of this trachea also to the right side. You can see the lung parenchyma, which has to be of almost this size, is being compressed significantly on the right side. So this is almost everything is getting pushed to the right side, causing also the compression of right lung parenchyma. So this is a very nice case of uh, this particular case was having osteosarcoma of the leg, of the tibia, and this patient had malignant pleural effusion, gross pleural effusion, in which an pigtail was put to drain this gross pleural effusion. So this is a very interesting case of a gross pleural effusion, malignant pleural effusion, causing shifting of mediastinum, shifting of trachea, and compression of the contralateral lung as well. That's all for now, and thank you.